r/AskReddit. Doctors of Reddit, what are some of your anti-vax parent stories? Not a doctor, but a story I heard stuck with me. The head of pediatrics from a Toronto hospital, I forgot which one, was giving a talk and told a story about how, early in her practice, she had a little boy in for his scheduled vaccines and was answering the nervous mother's questions. The mother planned to go ahead with the vaccines, but had heard lots of anti-vax propaganda, and so she was worried and had lots of questions while they were talking. But before they administered the vaccines, the poor little kid suffered a grand mal seizure. It was really bad. The kid ended up getting admitted to the hospital and suffered a fairly serious brain injury. It occurred to the pediatrician much later that if that seizure had hit 10 minutes later, or if the appointment had been 10 minutes earlier, nothing would have ever convinced that poor mother that it wasn't the vaccine that caused the seizure. Med school student here. I was getting my hair cut and I was talking to the barber about how more people should get the new meningitis B vaccine, since I know a person who got meningitis B and almost died. The desk lady went off about how vaccines are dangerous and pretty much every single anti-vax talking point. I explained the actual facts behind vaccines and said that I'm studying medicine. I think I might know what I'm talking about, and then she went off about professors not knowing what they are talking about and that they just teach what they are told to teach so that we can all be brainwashed into supporting the big pharmaceutical companies, and that my proof were all fabricated by them. Edit. Someone told me we made it into YouTube. Friend of mine is a military OBGYN. Was at a OB appointment with a pregnant dependent and service member. He had just returned from AFG a few months prior. OB mentions about follow-ups after delivery and first year of life, including vaccines. Wife says, I read on the internet that vaccines cause autism. I don't think we're going to do that. Husband says, I saw a lot of little graves in Afghanistan. Sure as shit we are getting our kid vaccinated. Not a doctor, but a nurse and a vaccine advocate. Once had a public argument with a friend from long ago. He argued that by not vaccinating his kids and risking terrible side effects and possible autism, he was placing no one else at risk. However, acknowledged the potential risk to his kids. After attempting to explain the potential risk to others and him failing to understand, I created an analogy which I still use to this day. Imagine if my kids and your kids get into the same car. Both of your kids don't put on seatbelts. Therefore, if there is an accident, there is an increased risk that your kids will die and also harm my children in the process. This seemed to click with him and he doesn't share his anti-vax propaganda on social media anymore. Not directly related to my being a doctor, but a mutual friend of mine and my wife's is a chiropractor and anti-vaxxer. Refused to vaccinate her first 2 kids. I didn't want her or her kids coming anywhere near our place when we had newborns or kids. 2 because of the risk her unvaccinated kids placed on my partially vaccinated babies. She got all offended, saying the usual rubbish like if vaccines work, what do your kids have to fear, and your kids are more risk to mine because they'll be shedding viruses. Her 3rd child was born with cystic fibrosis, which makes them very susceptible to all forms of respiratory and airborne infectious diseases. Suddenly the whole hypocritical family is vaccinated against everything. I'll tell a different kind of story. I am an ER doc and recently had this interaction with a patient. Adult male comes in with fever. He comes back positive for the flu. Me. You have the flu. I will write you for a prescription for Tamiflu. Patient. Doesn't that cause autism? This guy couldn't even remember that it was vaccines that reportedly cause autism. And he couldn't remember that it wasn't the flu vaccine. And of course he is wrong about vaccines causing autism. And he is a grown-ass adult that thinks he will suddenly be autistic. Not a doctor, but I worked at a children's hospital in research. At the time as a coordinator. A bunch of us were sitting in our office space talking about medical care of some sort casually. I think maybe flu vaccines. And one coordinator cuts in. Well, I don't know if you've seen the recent research, but there are a number of issues with vaccines that make them unsafe. They are highly correlated with autism. The room got quiet because everyone was polite. One person said, "Oh, I heard that. I think in an effort to not alienate the girl. I responded, "That's not true," because I couldn't not say that. She said, "Yeah. I'll send you the link." I said, "I think I've probably read the study. It's been rescinded." Then it got more awkward. This was probably 2017. I just couldn't believe that in 2017. A person whose job it is to understand research at a hospital with children can fall victim to bad research that has not been supported by any reputable source since probably the 90s. I'm not a medical doctor but a mental health therapist. Went to do a new client intake, and while asking the mother about the kid's medical history, vaccination records etc, she said he was not vaccinated because vaccines cause autism and she didn't want to risk her son getting it. Then when I went to meet the kid, within 5 seconds of laying eyes on him I could tell he was autistic. Worst part was that when I told her, she became very upset and started yelling at her husband saying he must have gotten the kid secretly vaccinated, and then immediately ran out the house and took the kid to the emergency room for testing and just left me and the dad in the living room just kind of staring at each other. Never answered my calls or texts again after that, and I had to get DCF involved. Not a doctor, but my former primary care doctor was a crazy anti-vaxxer. He told me I didn't need the meningitis vaccine because no one gets it anymore. Freshman year I woke up in my dorm and couldn't move any of my limbs. My roommate took me to the ER and I tested positive for it. I ended up staying in the hospital for 3 weeks and am lucky to be alive. The doctor is thankfully not practicing anymore. I work in a neonatal ICU. Our neonatologists also work as the pediatricians for the healthy newborns. Our medical director asked me to come with her to a mom's room because she anticipated some issues after speaking with the mom's nurse. MD explains the importance of vaccinations, vitamin K, and the state NBS. Mom: absolutely not. You need to do your research. MD: I'm double board certified. Have a MD and a PhD in biomedical engineering. Have 30 years of experience and I'm the medical director for this hospital's pediatrics neonatal department. I am published in over a dozen journals. I assure you the risks are minimal and the benefits outweigh them for the safety of your child. Mom: I bet Big Pharma paid you to say that. Coming soon to AskReddit. Funeral directors of Reddit. What are some of your anti-vax parent stories? Had a kid come in for generic upper respiratory virus. Asked mom if he was vaccinated, as is routine. She said no. When I asked why not, her response was, "Well, my boyfriend was vaccinated and he still got meningitis. So they don't even work." I told her that's the same as saying your friend got bruised by a seatbelt in a car accident. So you don't wear them when you drive. I feel like Family Guy said it best. There's an episode where Lois and Peter kidnap this child to get him to a hospital because the parents believe prayer will heal their kid. So Lois eventually has to confront them and says something like, "Maybe the vaccines and medicines are God's answer to your prayers. So why keep praying if you're going to wipe your ass?" with his reply. When I was a medical student, I had a 5-year-old patient who looked and acted like a 2-year-old. Failure to thrive. His mother was super weird. She shaved the sides of his head, somehow like a marine cut, but kept his back hair long. She refused to vaccinate him or even feed him certain foods. Her sister and her husband were trying to get custody of the child because his mother was weird and didn't take care of him properly. I suspect she was paranoid. She would literally fight and call you names if you attempt to suggest to put the kid on a proper hospital diet. She wanted to inspect the food first and make sure he eats only certain things. Long story short, the attending calling county and they took the child away from her. Edit. Thank you for those who pointed out that the haircut is called a mullet cut. Another point to add. He was admitted for a fracture, which was really worrisome in a kid that age. Unfortunately, I don't know what happened to the kid after they took him away. But he's definitely better off. Not a doctor, but I'm a brother of the victim. My mom has this belief that vaccines cause mental illness. She forbid us to go to the doctor. And 6 weeks later my sister got sick and died from measles. I am now as distant from my own mom now. These stories should be compiled, printed, and left in the waiting rooms of every ER, OBGYN, and pediatrician's office across the world. Okay, this is hardly related, but anti-vax dog groups are also way too fucking prevalent. The rescue group volunteer who matched us with our dog seemed totally normal until we went to pick him up. Then she started on how unfair it was to force the rabies vaccine on dogs, WTF, and how she made sure to get our soon-to-be pup the bare minimum vaccines required for transfer. He's from TN. We're in MA. Handed us a pamphlet on one vaccine in particular that veterinarians might try to bully us on, DHLP I think, since he's considered at risk, and encouraged us to refuse it. I smiled, nodded, and got my dog fully vaccinated that week. Not a doctor, but my sil was very much on the fence about getting her daughter vaccinated. She's a smart and rational person, but it shocked me to hear. I had to come at her from an angle of compassion and told her that I understood she wanted to do what was best for her daughter, and a lot of what she had seen on FB had made her scared and confused about what that right thing is. I had to explain why the vaccines causing autism was false and how herd immunity works, especially with my niece in nursery. It worked, and she sold it to my niece that if she had the injections then they could go on holiday abroad. Pediatrician. Me. I read in the chart you refused the hepatitis B vaccine in the newborn nursery. Any particular reason? Mom. I wanted to wait and think about it more. My husband has hepatitis B, so it's not that bad, right? Me. Dot. Huh. I had a 76-year-old anti-vax patient the other day, although not really a parent story. Funnily enough, she came in for her flu vax and the conversation went like this while I was preparing to give it to her. Huh? They're injecting too many chemicals into people nowadays. Me. Confused. Do you want your flu shot then? Huh? No. I mean the children. Back in my day we all had measles and got over it. I think it's better for the body's immune system to handle it. Me. Actually, rates of deaths and complications from measles were much higher in the past compared to complications of vaccines. There's actually this video that explains it quite well, referring to the recent Kurzgesagt video. Huh? I despise those things. Computers. Televisions. I won't watch it. Me. Okay. Let's just agree to disagree. Just thought it was funny how she obviously wanted protection from the flu instead of letting her immune system do the job while criticizing childhood vaccinations, when kids obviously lack a fully developed immune system. Also, she obviously wasn't getting her info from any up-to-date sources given her disdain of TV computers, but I guess her gut feeling trumps my medical knowledge. My sister and I are both biomedical scientists. I study intellectual disability and autism-related disorders. My sister studies viruses. You could not ask for two more appropriately specialized people for this discussion. My sister-in-law is still anti-vax. And she is not a fan of us lol. She's a nurse and a mom. So she thinks she knows better than the people whose literal job it is to be on the cutting edge of healthcare. If I try to disagree with the nonsense she pulls off Facebook, she insists she needs hard facts, not just opinions. If I offer her proof through well-sourced research, she's here for discussions, not research articles. Some people can't be reasoned with. 41-year-old first baby. Refused vitamin K at birth, which lowers risk of significant bleed. Refuses Hep B vaccine. Had rupture of membranes for 72 hours, which you normally treat with antibiotics. Baby came out fine initially but became unwell 3 days later. We noticed when assessing baby that mom was taking antibiotics herself after developing a fever. However, was completely against the idea of baby getting antibiotics. We made it very clear that this could have all been preventable if she had antibiotics during labor. It's sad when babies don't get a chance because of their douchebag parents. We had a 14-year-old female come in for abdominal pain one time. She weighed 80 pounds. Looked sickly. Her mother refused to let her eat anything but a handful of things. Nothing with very much protein at all. She literally had a binder full of articles about how horrible vaccines are, all the bad things they put in food these days, etc. She had completely brainwashed this kid, so the kid believed it too. Her labs showed malnutrition. Her teeth were horrible. Just a sad case all around. I don't want to get the flu vaccine because every time I get the flu my immunity becomes stronger. Folks, The vaccine makes your immunity stronger. The flu changes strains every season. My PT did not understand this concept. I really tried explaining too. This particular PT also had many comorbidities, such as end-stage renal disease, that would make catching a strong flu potentially life-threatening. Very sad and very frustrating. Internal medicine resident. I want to hear pro-vax stories. Egg. A parent came in and I told them their child needed an MMR vaccine. The parent agreed, so I gave the child the shot. The child lived a healthy life and didn't get autism. As an emergency pediatrics doctor, I see a lot of unvaccinated patients. The one thing I don't see are unvaccinated patients from any second or third world countries because they remember what these diseases are and can do. My advice: get the vaccines on the schedule and quit wasting time thinking about it. Worry more about unnecessary antibiotics or steroid therapies given to your kid. They have frequent common side effects. Other than a needle poke. Vaccines don't. Vaccines are by far the safest medical therapies we have. Consider getting vaccines. A tiny price we have to pay because we live in society, like stopping at red lights in the middle of the night when no one is around. BC some idiot is driving with no lights on coming down that side street. PS I get no secret checks from the government. My kids are all fully vaccinated. I am fully vaccinated and actually get extra vaccines because I am in the healthcare field, so I don't spread stuff around. Let it go. Concentrate on researching something else. PPS many in the anti-vax community make a lot of $ selling misinformation. I get nothing for telling the truth. Who should you believe? Be well. Okay, I am not a doctor, but I'm pregnant, so I see one pretty regularly right now. Lol, it was time for my TDAP booster and I was asking about the MMR booster. My OB asked if we are planning to vaccinate the baby. And I told him that shouldn't even be a question he feels he needs to ask any of his patients. So he told me this story about a teenage patient who came in with her mom. The mom was going on and on about how she teaches her child to live a healthy and holistic lifestyle free of drugs, vaccines, and chemicals. Well, turned out the daughter had gotten gonorrhea from her boyfriend despite her healthy and holistic lifestyle. My OB said he felt great seeing the mother's face when he delivered the news. Lol. Not a doctor. Several years ago during a bad flu outbreak, hubby and I were visiting family members. Chatting away. Hubby mentions that he had lost a second co-worker that month to complications from the flu. Grumpy in-law is bellowing about how flu isn't real. They only want you to get shots to make money off of you. Yada. 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 Meanwhile, the news blaring from the screen in front of them is talking about 3 local medical centers are overwhelmed with flu patients in the ICU. Most of which were pregnant women. Of course, this is the same family member who firmly believes that the graduates of Bible college come away with a far greater education than medical doctors. She demanded to know when had any good come from Harvard Medical. I said polio vaccine. She claims polio has never existed. It's made up to get us to take poison. Auntie Vile, you were a teenager in the 50s. There is no way you could be unaware of polio being real. Some people just want to be stupid. Obligatory not a doctor. My best friend and his wife just had their first kid about a week ago. Yesterday a friend went to visit them with her unvaccinated child while my fiancée and her mom were there visiting as well. First fucking thing out of this friend's mouth where you can use essential oils to pull the metals from the hepatitis vaccine out of the bloodstream. I got diabetes from vaccines. In a cemetery in Addison, Alabama, there are 5 graves in a row, each with a date in the early 1900s. Near them are their father and mother, buried nearly 50 years after the 5 children. The children all died of pertussis before reaching 6 years old. I can show you the graves and tell you the story my relative told of the heartache her parents felt as they buried each one. This was long before vaccines were available. I have heartbreaking pictures of the stones marking their graves. I am very thankful my 4 children were vaccinated and did not die of such a deadly disease. There are 5 graves in a row. I'm not a doctor, but try researching the guy that claimed vaccine causes autism. Struck off for falsifying and making up the results. Performing procedures that harmed kids. Not a good man. Educational books and posters. I looked for 2 years to find the right information to put in my office. Each room now has a poster and a book. It's a wonderful feeling to go see a patient and they are flipping through the stories. Many have asked how they can buy the books to send to others. My policy for the few patients unvaccinated in my practice: you must sign a document that you acknowledge your decision regarding your children and you can only be seen at the end of the day. I have a due diligence to protect newborns. All unvaccinated children must be declared at the front window and are required to wear a mask and brought to the back room if they are walk-in. I work in a rural area and people are not friendly to those that put their children at risk. Med student here. One of the well-known, respected professors at my state college let it slip during a lecture that his wife is anti-vax. This was shocking because not only is our professor very pro-vax, but he's a microbiologist. His wife works as a midwife and is a highly educated woman. She wasn't always anti-vax and quickly adopted the view alongside the oncoming trend. Once their children were born and older, my professor attempted to sway his children into some late vaccinations, but they wouldn't budge, mostly out of laziness. I asked him how he could compromise on something like this, and he told me they'd nearly divorced over it. It was something they just couldn't agree on and were never going to. So he caved. I think I am too young to comprehend his reasoning, but if my partner was suddenly against vaccinating our children, I would leave. That's not something I could have in my life and that's not something I'm willing to compromise on. Had a 5 or 6 years old patient who had a super hippie mom. No reason for not vaccinating other than she doesn't want to despite counseling many times. Kid also had asthma and would consistently come in for exacerbations despite prescribing appropriate controller meds. The amount of exacerbations just didn't make sense. One day, I sent my student to see him first while I called the pharmacy to see if his meds were received. The student came back saying I can't get a history from mom. She's literally falling asleep while talking to me. Also, pharmacy said the meds haven't been picked up from the last 3 visits. That was enough for me to call CPS. Mom was on drugs. Living situation deplorable. Last I heard, kid was moved to an aunt who caught him up with age-appropriate vaccines. This one time this lady came in for a checkup. The child had not been vaccinated yet and I told her she needed to vaccinate him. She said that she didn't want any needles touching him because she didn't want him to get autism from the needles. She wanted him to get an ass spray of the vaccine. To this day it left me very confused and I told her we didn't do that so she left. Maybe an anti-vax but IDK anymore. Nighttime driver for strippers here. Had a girl swear up and down if she ever had kids she would not vax because vax kill and cause autism. I spent the whole night trying to explain why vax are good and necessary and that she would only be cheating her children of a healthy future over nothing but false information. I encourage her to seek out professional and even come to Reddit. But at last her response was, I don't think you understand how pharma pay off all these people. Edit anyone else missing their pharma payoff checks? I haven't received any yet. Edit number 2 thank you everyone for all the upvotes never gotten this many before thank you. Not a doctor, but I have some input. I was doing an admission on a patient and I asked him if he had his flu vaccine for the year. He angrily stated, no. That shit is poisonous. Then continued to hound us for his opiates throughout his stay even when they weren't due to be given. I asked my doc this for a paper I was writing. Worst case he saw as of yet was a little boy with chicken pox all over, especially his genitals. So bad the kid may be sterile when he grows up. It's so sad that these parents would do this and just watch their kids suffer. You did this to them. I've told this story before, but the worst was when I was in medical school. The woman actually brought her daughter in to get catch-up vaccines. Why? Because her other daughter was in the ICU with fulminant meningitis from a vaccine-preventable illness. Hanging on for dear life. The nurse there sat her down and told her point blank that she rarely sees this disease because people are vaccinated for it. The mom couldn't understand how her girl had contracted it. We asked if she knew anyone who wasn't vaccinated. Apparently no one in her church vaccinated. And several had been sick recently. She couldn't believe the source could be them. The kicker? She also brought her son to clinic, but refused to vaccinate him. saying he's my only son. No matter how we explained it to her, she believed giving her son the vaccine would result in brain damage. Obligatory, not a doctor. But I have a good friend online whose mom is anti-vax but his father isn't. She's convinced that she has successfully raised a healthy, unvaccinated 16-year-old, but in reality his father takes him away for a birthday trip where he gets vaccinated, then they go out to a mess up or something and get a gift, so it looks like they just spent ages browsing. Also, my aunt has many anti-vax friends but vaccinates a 3-year-old. Around his first birthday, she was inviting a bunch of people to the party. When she remembered that they were anti-vax, she immediately uninvited them unless they vaccinated their kids. Spoiler: they didn't. This would have been especially dangerous if they had come, because my cousin had just gotten 3/4 of her liver removed due to cancer, and she had virtually no immune system. Some people are just plain stupid. Doctor here. Guy decided to not get a flu shot this year. Ended up in the ICU with flu infection in his brain. He has currently been in the hospital for a month, most of which in the ICU. Has likely permanent speech difficulty and left-sided weakness. These people don't deserve to have kids. I had someone once come in with their kid for a college physical. The mother produced some letter from a phony baloney church about how it is against their religious beliefs to be vaccinated. Never had I thrown someone out of the clinic so fast. I did not want to endorse anything that would allow this Satan spawn to live in a crowded dorm with anyone where he could give someone mumps. Facebook is literally pushing human intelligence back a notch. When I was a med student, I had a parent who wanted to do a delayed vaccination schedule. Basically it means that you get all the same vaccinations but you pointlessly and foolishly do it over a longer time period. The mom had read a book promoting this practice that was unfortunately written by an MD. My pediatric attending had zero chill. Is that the book written by DR? Yes. Well, then you should know that I was in the same medical school class as DR, but I got much better scores than he did. I went to Asia recently. Went to my doc beforehand. Told her where I was going, and when she said so you'll be needing travel shots, I said yep. Gimme all the autisms. Doc. She was not amused. I am not a doctor nor anti-vaxxer, but my parents' friends, which I am also close friends to, plus to their son and daughter, didn't vax their children. Nothing really bad happened, just that their son, which is 3 years older than me, I am 23, got a tick to bite him during a hiking trip. Over here, Switzerland, ticks can pass 2 diseases. Meningitis, which is vaxable every 7 years, a fake, and Lyme disease, which is not vaxable but treatable with antibiotics. After the tick bit him, every sign showed towards a Lyme disease infection. The parents decided to not do anything but using homeopathy and stones to cure it. The problem, however, is with Lyme disease. It doesn't show signs for ages, even decades. So now chances are that in 10 years from today, infection happened 7-12 years ago or something, the disease will start to develop and hamper his movement. So back then he didn't really know what he should have done, so his parents just ruled over him without giving him the option to go for antibiotics. My only hope is that the disease doesn't develop and he can live in peace. Not a doctor, but have taught one girl whose parents are anti-vax. Being anti-vax doesn't just affect health, but it affects a child's social development too. Girl was sick for most of her life and missed out on school. Therefore, she missed out on socializing with her friends. Caused her to be anxious about coming to school and thus caused more absences. Apparently her mum would have to drag her screaming child out of the car every day. The girl becomes very sensitive about jokes children make, and parents call in to demand that those who tease their daughter be reprimanded. Those peers are talked to, and turns out it was a stupid joke about poo that children her age make. Girl couldn't handle being around other children who joked and continues missing out on school because she was being teased. What do parents do? Pull her out and homeschool her instead. Current medical student here. On my ER rotation we had a mom bring her son in for typical cold symptoms. When asking about vaccinations, she said, "Oh, we don't do that." The kid was pretty uncomfortable, but not super sick, and clearly just had a simple viral upper respiratory infection. We could have just sent them on their way, but thankfully my resident took the time to explain to the mom that because he wasn't vaccinated, we had to rule out a bunch of serious stuff like whooping cough, measles, etc. He explained how critically sick those kids can be and how much worse it could get for her son in the future. By the end of the talk, the mom asked if we could vaccinate her child in the ER. We can't BTW for anyone that doesn't know. Moral of the story though is to keep fighting the good fight. You never know when you might finally get through to someone. After reading lots of comments in this thread, it comes in my mind just one thing. Facebook, Google, Wikipedia, YouTube, Netflix and so on needs to start a heavy campaign to destroy these anti-vaxxers bullshit once forever, and whoever says the opposite must pay the consequence with public shame. Same for flat earthers. We used to laugh at those people for their ignorance, but instead of keeping them on their ignorance and hope that they will stop being stupid, it just rises. We truly need to fight these bullshit. People used to believe in witchcraft and killed lots of innocents because they thought they were a witch. They were ignorant. Nowadays sane people do not believe in witchcraft. Today people believe that vaccines causes autism and that the earth is flat. The story repeats itself. Med student on psych rotation. A woman comes in with her baby and the doc is busy. She has me sit in and start the interview. The mom was coming in for her Xanax refill and a letter from the prescribing doctor. She's been on Xanax for 10 years, including through both pregnancies and the birth of her recent child. Her baby was born with benzos in its system. The interview went like this. Me. What kind of things do worry you? Huh? Everything. Parenting. Germs. The flu. I'm worried all the time. Me. Yeah, the flu is bad this year. Did y'all get the flu shot? Huh? No, we don't do flu shots. My kids are under-vaccinated. I know 3 parents whose kids got the MMR vaccine and got autism. It was so hard remaining professional for that. Wanted to bust out laughing but also ask. WTF lady. Her baby wasn't old enough for MMR yet, but man, I hope she changes her mind until then. TL. DR mom addicted to Xanax who took it during pregnancy said germs were her biggest worry, but she wasn't vaxxing her kids because autism. All the anti-vaxxers are currently fuming and downvoting all comments. As a physician, I still don't understand how it's optional. Hi Reddit. My mother is anti-vax and I am not a doctor. This was only a recent decision of hers as I am 21 years old, live out of home and vaccinated. But my 3-year-old sister is not. Any doctors or people who have any ideas on what I can do to rationally change her mind? Because I'm not letting my sister go another 15 years unvaccinated until she's 18 and decides to get herself vaccinated. Or worse. Believe she doesn't need it. Edit. I get this isn't a correct response to the question as it's not an answer and I'm not a doctor. But I saw this post as an opportunity because this was so recent. Nothing crazy. But I once saw the list of allergies this 9-year-old kid had and attempted to clarify each one. People often mistake side effects for allergies. Gluten was one of them. Asked if he was celiac and mum had no clue what that was. Asked what happens when he takes gluten. Oh, his left ear becomes very waxy. And what do you know? No, he's not vaccinated. I will not put that poison into him. Not a doctor but so, significant other, works with children that have autism. She has one parent that consistently tells her she regrets vaccinating her kid. She then asks questions to MISO about which vaccines are the ones that cause autism as if it's a big secret. MISO tells her that autism is predetermined before birth and signs just aren't noticeable until around 2 years of age. She still tries to justify her logic with other anti-vax parents' stories from FB. MISO has 2 master's degrees towards this field. It blows my mind how they can still argue with overwhelming facts. Not a doctor, but learning to become a medical assistant for laboratory, and we have to work for 6 weeks as a nurse. I was allowed to go to the mother's ward. Awesome time. Till one mom said her baby boy will not be vaccinated because it's literally like poisoning her baby. The doctors and even her husband tried to change her mind. She didn't. The father of the boy said to do it behind her back and that he would do it like that for the rest of his son's childhood or his wife became normal again. Because he wants a son, not a corpse. And I thought you only see this shit in the States. But sadly it is coming to Germany. Not a doctor, but as a mother who vaccines all her 4 children, I realized anti-vax was a big problem when my smallest was hospitalized for RSV bronchitis, and the doctor and nurses kept asking over and over after coming in and out if she was vaccinated, which is yes. As well as at the children's hospital she was transferred to. I was never asked this much when I told my others to the urgent care when they had high fevers. Each one experienced urgent care only once. Thank goodness. But it was weird to me. Obviously they are doing their job. But I almost felt like they didn't quite believe me for some reason. But IDK, maybe it's just me. RSV doesn't have a vaccine. Well, only for premature babies. I believe I might be wrong though. I, as a 5th year student, might say that it actually happened to me once. We have the opportunity to be translators for doctors that came from United States, UK. I am from El Salvador. And it's even harder for us when a woman says to us that she doesn't want her children to be vaccinated. The last time I had to translate for a US doctor, very cool dude, a mother came with her kid. 2 years old girl. Very sick. And the only thing that she gave her was fish and palm oil because her 79 years old mother, the kid's grandmother, told her to do. I'm not lying when I say that. After the doctor said to me what I have to say to her, she almost slapped me because a vaccine can cause, not autism, but something that here is called Maldi Luna, or pseudo disease where the little kid gets paralyzed in a moon shape. And the only way to heal it is with Olympia. Kinda weird. Funny though. Nurse practitioner here. Child came into the emergency department with a rash and upper respiratory symptoms. He was mildly autistic. Definitely high functioning, cute, nice kid. Vaccination status changes the whole workup. Mom reports that he didn't get his full series because he is autistic, and obviously that first vaccine at birth caused it. So because of the lack of vaccinations, the differential list is much longer and the kid gets a more invasive workup than the kid that got all his vaccines. I just think, why don't you just vaccinate him? He's not going to get more autistic. I wanted to say that Saru bad, but respectfully didn't when she complained about the additional tests. Had rubella, by the way. Totally preventable with vaccinations. What's worse than parents not vaccinating their kids? Doctors who support this. There are an entire network of doctors who support anti-vax. Taking Junior for his first MMR shot in a few hours. Ugh. Not a doctor, but reminds me of a Facebook post I saw a year or so ago. If I can find it, I'll post it. Long story short, a mom was asking her fellow anti-vaxxers for relationship advice. She had one child die of meningitis, and after it happened, her husband, without her knowledgeable, took their other child to doctor and got them fully vaccinated. Mom was upset about all the illnesses the doctors just gave living kid and wanted to divorce husband over it. Studying to be a veterinarian. Hendra virus is a zoonotic, spreads to humans, disease found in horses and spread by fruit bats. It's named after the suburb of the original outbreak. Most often occurs at places with high horse traffic. That is, stud farms and racetracks. Anyway, people refuse to vaccinate since they think it makes horses lame. It doesn't. There's not evidence to suggest this. There's actually been huge studies published by the University of Sydney saying there's little correlation. So you know. That's cool. I had a patient tell me he didn't want the flu shot, although he has horrible asthma, because his wife's cousin's nephew ended up in the ICU after the flu shot. Because he got autism. In the ICU. For autism. I am sure it was probably Guillain-Barré syndrome, a rare and sometimes life-threatening adverse effect of the flu vaccine, but dude thought this kid ended up in the ICU with autism after the flu shot. Not a doctor, but my physician was telling me about one of his patients who decided to give her 2-year-old child coffee enemas rather than vaccinate him. She kept screaming the chemicals within the coffee were just as effective as a vaccine. Then she repeated the mercury line and started ranting that the government puts vaccines in all fish, so we're all indoctrinated anyways. Cool guy he was, he just nodded along, waited on her to storm out, and called CPS. I'm not a doctor, but an RN in public health. I recently had a mother call me to ask me if it was a smart idea for her child should get the MMR vaccine. Why was she asking this? She was worried that would make his autism worse. Not a doctor but a nurse. I had a patient who was in the postpartum, mom and baby, unit. Getting discharged from hospital 24 hours after giving birth. She hadn't received her measles, mumps, rubella vaccine yet. We offered to give it to her. The MMR vaccine is a live vaccine, so the virus is weakened and injected into you, and it is thought that there is a risk that the virus can transfer to the fetus. So this is the perfect time to get vaccinated because people generally don't get preggers until at least a couple months after their last pregnancy. Her husband fucking lost it on us, absolutely not. How dare you blah blah. Her husband went to bring the baby's car seat in from the car and she said quick while he's gone. We gave her the vaccine and she promised to get her baby vaccinated when able. Imagine 4 years pre-med recs with top flights GPA. Killer MCAT. 4 years med school. Residency. And you are second guessed by a single mom with a sub 1000 SAT. Not a doctor but there was this kid in my class with anti-bad parents. Ended up missing school almost every week with 71 total absences. I work at a clinic that doesn't treat kids, work-related illnesses and injuries, and I never really treated kids. So not many. One woman asked for my reassurance that she was doing the right not vaccinating her kids because other doctors haven't been happy about that. I told her that she would have to meet with 100 or more doctors to find one that agrees with her. She rolled her eyes and condescendingly said, I guess you're all bought by Big Pharma then. I called her a fucking idiot and told her to go to another doctor next time. I worked for a pediatrician and family physician who had 3 children also in the medical field. When the daughter had children, wait for it, she didn't want to vaccinate her offspring. When the pediatrician told me and then humored the idea that maybe she was right about the autism conspiracy, I lost all respect for her and her 30+ years as a pediatrician. My almost 14-year-old daughter's boyfriend's dad is an anti-vaxxer. He talks to me about all of these conspiracies as if I share his passion for conspiracy theories. We were sitting in my front lawn one day and a low-flying commercial jet went overhead. Likely in a holding pattern for Providence Airport. He looks at me and says, well, at least it isn't dropping chemtrails on us. Have you looked into chemtrails at all? It's scary stuff. Dude has 5 sons. And at least one is very autistic. Just better than non-verbal. If there was something wrong with that kid, there would be no way for him to say mom, dad, Mises hurts, my heart breaks for the kids. Well, except for my daughter's boyfriend. He's a shit. So the govt of my country decided to make HPV vaccines mandatory in secondary school, somewhat akin to high school for Americans. And parents were against it because they were convinced that this would be encouraging their children to have premarital sex. It blows my mind when anti-vax parents refuse the vitamin K shot during infancy. It's not even a vaccine. It's a vitamin that helps with blood clotting. Despite having a discussion that newborns need the vitamin K because their intestinal bacteria is not developed enough to make it. It baffles me that parents still decline it because they don't believe in vaccines because Big Pharma, mommy blogs told me to say no, etc. It is awful when you then see some of these infants in the NICU because they had a brain bleed bad enough that they may die or will affect their long-term development when it could have been prevented. Now I mainly work with an immigrant population where parents come from countries that have seen these scary diseases. Some of these families ask to get the flu shot twice. In a similar vein, my wife and I took my daughter to the dentist the other day. The hygienist asked if it's okay to give my daughter a fluoride treatment. I was like, yeah, I don't have a problem with it. You? As I motioned to my wife. Nah. The only negative thing I heard about it was from my coworker. She said it occludes your third eye. Another hygienist working on another patient groaned so loud over the sound of suction. We all had a good laugh. My father has been a family physician for 30 years. He recently told me about a kid and his mother who came in and the kid was super ill, coughing a ton, whooping cough, and just looked terrible. The mom was apparently super against vaccines and my dad said he told them she could either give her son the vaccine Or she could buy him a very nice casket and hope for better luck with future kids. She got rather upset. But his idea is that there is no sense sugarcoating it. Nearly qualified pharmacist here. So obligatory, not a doctor. Our pharmacy offers travel vaccines for people going away to countries with a higher likelihood of severe tropical disease. Star parenting goes to the parents who got themselves vaccinated for rabies. But not their two primary school age, elementary. For non-Brits, children. I only see adult and geriatric patients. Everyone after age 65 is supposed to get a series of pneumonia vaccines because pneumonia is a common cause of morbidity in the elderly. Conversation I have on a weekly basis. Me. So you're past the age of 65 and now's the time to get your pneumonia shot. Patient. I don't do those. I've never had pneumonia. Me. Well. You've never been 65 before either. This is when it starts getting serious. Not a doctor but a phlebotomist. A patient came in to get her blood taken. She hands me the requisition form and I'm prepping the tubes and needle and what have you. She says, is this gonna give me autism? What? I say. No. How can you be sure? Because all I'm doing is taking some of your blood. You're not gonna inject me with fluoride? I'm not injecting anything. Just taking blood out. If I become retarded I won't hesitate to sue. Okay. Mum. I took her blood. She was chill afterwards. I know it's not the most wild story but you know. Little late to the party. But oh well. Hopefully someone reads this. Currently 4th year med student. Last year during pediatrics I had a doozy. When I started on the service. This kid was already on death's door. He had a sinus infection that had spread into a meningitis and brain infection. All from a vaccine preventable bug. This family was for sure a bit out there. They had been traveling around the country in a camper and would look completely at home at a Grateful Dead concert. To give you some context. By a great stroke of fate. The antibiotics were incredibly effective. And he eventually recovered with no noticeable long-term damage, which is insane. During that time. A few of the residents had some respectful but direct conversations about how this all could have been prevented. Turns out the parents were reasonable despite being so quirky. And agreed to get their son fully vaccinated before leaving the hospital. Poor kid had to get literally 10 jabs that day I think. But I'm ecstatic that he did. It's one of the few feel-good stories for this thread. I'm not anti-vax myself but I have a friend that is. Recently he got measles in the measles outbreak. Thankfully he survived and is now good. But my stance on anti-vax is this: people have a right to religious freedom. However, they do not have the right to put their own kids and their friends and classmates in danger because of their beliefs. Being anti-vax should be considered a grounds to not allow someone in the profession. Simply because it is a serious sign of incompetence. All the meds being used, procedures, etc. depend on the same standards of science. So if they can blithely ignore those standards for one thing, why not some others? Doctor, your newborn needs this vaccination. Would you like us to give it here in the hospital or at your pediatrician's office? Mom. Oh, I'm not going to vaccinate my child. My friend shared this article on Facebook about the dangers of vaccination. Doctor. Oh, okay. What medical school did your friend go to? Mom. Oh, she didn't. In medical school I saw a kiddo whose parents refused vaccines, and so when they were given the vaccine refusal form to sign. This form essentially said that the parents understood that refusing vaccines was against medical advice. That their kiddo could get sick from all those preventable diseases. And that they wouldn't hold the doctor practice liable for any complications that the kiddo may get from said preventable diseases. This mom pulled out a Sharpie and blacked out the part about the doctor not being held liable. The parents thought that we'd be cool with them just changing that form just for them, and they wanted the doctor to be held liable for their moronic choice. Of course this didn't work and they were told to sign the form or they would be discharged from the practice and have to find another. They refused to sign and were told to leave after given a list of other pediatricians in the area. If you want to get nothing in return, you can like and join my Discord. There is a link in the description.